So what do you tell patients when they ask you to remove as much fat as you possibly can during their lipedema surgery?
Yeah, it's a good question. It comes up a lot because patients want to have as few number of surgeries as possible. So the idea that they think is best is to take as much fat out as possible. And for patients that are really severe and we're doing high volume surgery in the hospital, that can make sense because you get a more relief more quickly. But for most patients that are stage 2 or stage 3 or even early stage 1, taking out as much fat as possible can leave you with loose skin. That can be, you're trading one problem for another. You have heavy skin with fat in it to deflated skin that feels lighter, but then now you have the cosmetic drawbacks of having loose skin. So what I see with most of my lipedema patients is that the benefits don't necessarily scale with how much that you remove. And what I mean by that is you can take out a certain amount of fat and you get the benefits from the surgery. So the decreased pain, the decreased heaviness, but you don't necessarily inherit the risk of having loose skin. Whereas if you take out every scrap of fat as much as possible, you'll get the benefits of the surgery, the decreased heaviness, the decreased pain, but you're almost certainly going to have loose skin. So you're swapping one problem for another. So for most patients, I recommend taking out a reasonable amount of fat, being moderately aggressive, but not necessarily creating that loose skin. And most patients are happy with a little bit of loose skin, but they don't want a lot of loose skin. So if you can keep it to where you give them the benefits of the surgery, decrease the size of the arm, but also don't have the secondary drawbacks of loose skin afterwards when they don't necessarily need an arm lift or a thigh lift, then patients are usually very happy with that result, and you don't need to take as much fat as possible.